Good morning and welcome to KEDA's COVID-19 webinar series. Thank you for joining us today. With us today, we have John Kiess with Kitsap Public Health, Congressman Kilmer, and Cole Medina, Executive Director for Kitsap Community Foundation. Teresa, next screen. Okay, so I'm going to do a quick poll to get us started. We're just curious what your status is 3 months in. Are you open and you haven't had any changes since the beginning? You're just doing remote working, you're open now with restrictions, or you're still closed? Just a couple more seconds for the voting. So it looks like the majority are open now with the restrictions put in place on the phased openings, and thankfully no one is still closed. And then one final question, and this is to kind of get us set for today's presentation. What concerns do you have for the coming months? More COVID cases, having to shut down again, not being fully recovered, you're concerned about closing, or you have other thoughts or concerns? And if so, please put those in the chat. See, a couple of people have said other, so please put that in the chat. Gonna share. Pretty, of course, yeah, we're all concerned about more cases. And then under other, it was, one said all the above, and one was just concerns for other organizations and businesses and an economic fallout. Thank you all. So, Teresa's been showing the website. PPP still has that June 30th deadline, which is next week. We still continue to update our website. I will warn you that our website has been a little uncooperative this week. So if it doesn't load, just keep trying because we're doing our best to fix that. And I will note that this is the last of our weekly. We will be taking a break and coming back July 16th, more at that at the end. And now I would like to turn it over to Congressman Kilmer. Thank you.
Super. Hi, Kathy, and thanks to KEDA for the invitation to participate. I am in our nation's capital, so good morning to you. It's good afternoon over here. I'm going to just stick to speaking to some of the efforts to address some of those concerns that you just pulled on. Since the pandemic began, we've seen 4 federal relief packages passed into law, focused on helping small businesses, helping medical providers, helping frontline workers, but it's clear that folks are still struggling. And I think, frankly, more action is required at the federal level. So let me focus really on 4 things. And first gets at what was very much the highest polling issue, and that is, how do we prevent more cases? One of the keys here is that we need to get testing right. And in the absence of that, we aren't going to be able to open the economy like we all want. I think people forget the time frame sometimes, but it was February the 4th when Senator Murray and I led more than 50 members of Congress in a letter to the Centers for Disease Control calling for an aggressive ramping up of testing capacity. And, we're now towards the end of June and our nation still isn't where we need to be. It's disappointing in part because we really need to have a national testing strategy to increase testing capabilities in our country. Public health professionals have said that our nation needs about 500,000 tests per day at a bare minimum. Some have suggested that the number should be more like 5 to 10 million tests per day. It wasn't until the weekend of June 19th that the United States finally reached the 500,000 tests that was considered the bare minimum. So why does this matter? It matters because testing is a key piece in the puzzle to getting control of the pandemic. You got to find out who's sick, do the contact tracing, see who that sick person has come in contact with, make sure that the person who's sick is isolating themselves so they aren't infecting more people, that they aren't coming into your workplace, either if they're a coworker or a customer. And then for those that they came in contact with, ideally quarantining folks who had come into contact with someone who's sick. In countries that have seen their economy kind of bounce back, that's what's worked. That's what's worked in South Korea and in Germany. Unfortunately, so far, the US has really struggled. And the blueprints are there for what we need, but the right levers just haven't been pulled yet. I will tell you a couple things I've been pushing for. One, more aggressively using the Defense Production Act so that we're using American manufacturing might to make sure that we're addressing shortages of things we need to ramp up testing, things like swabs and reagents and other supplies. I've also supported legislation to require for federal coordination, because in the absence of that, what you have seen is states and localities competing with each other for scarce resources, and it's sort of replicated the dynamic in the toilet paper aisle at the grocery store, but we're not talking about toilet paper, we're talking about life-saving equipment. So that's step one. We got to get testing better in this country. Second, we have to do more to help our employers. I'm a big believer that small businesses are not just the backbone of our economy, they're our economy's star running back. If you look at how we generally rack up the tough yards and score the touchdowns coming out of a recession, it's the small businesses that are growing the jobs. But unfortunately, in the face of this pandemic, they're getting tackled behind the line of scrimmage. I think it's really important that the federal government call some plays and do some blocking for our star running backs. So what does that mean? Well, one, the CARES Act provided, I think, some helpful resources, the economic injury disaster loans, the Paycheck Protection Program, and you've seen, even though there were bumpy rollouts, you've seen adjustments made to provide greater flexibility to employers. I'm working on other legislation to provide more resources in that regard. One of the things I want to flag for you is something that I think could very well make it across the finish line. My hope is before the end of the month of July. And it's an expansion of what's called the Employee Retention Tax Credit, which is a credit against your federal payroll tax that would be available to businesses that have been economically hurt by the coronavirus to enable them to keep folks on the payroll. And essentially, that tax credit would encourage businesses of all sizes to retain their employees so workers can continue to receive income and employer-sponsored benefits without having to seek unemployment benefits. The idea here is to help workers and businesses be better positioned to resume operations once this crisis has come to an end. That part of the reason I flagged this is that has been a bipartisan proposal. There's a bill that I'm a sponsor of called the Jobs Credit Act. It was included in the HEROES Act, which has already passed the House, and you've seen bipartisan support for this idea. Third, we have to do more to support our communities that are on the front lines of this, including our education systems. A few weeks ago, the governor announced that the state's expecting an $8.8 billion shortfall over the next 3 years due to the COVID-related economic downturn. And the concern that we should all have is if you look at where about 2/3 of where the state budget goes, it goes to K-12 and higher ed. And I can tell you, having worked for the sister organization to KEDA, an economic development association in Pierce County, what we know is our ability to educate young people and provide skills to folks through our K-12 and higher ed system is fundamental to our ability to grow jobs and attract employers and grow employers. And so if we whack the bejeebers at a K-12 and higher education, that will move us in the wrong direction economically. Not to mention the fact that in the absence of additional federal support, there's a real concern that we'll see just massive layoffs. We've already seen down in Aberdeen about 40 school teachers get pink slipped. Our community colleges, including Olympic College, have been asked to prepare a budget that would be cut their funding by 15%. The city of Tacoma has already laid off more than 250 municipal workers. And these examples I'm giving you are not unique instances. Unfortunately, every city and county in the district I represent, and certainly many of the school districts, are trying to figure out what the path forward is. The concern, and you heard this from the chairman of the Fed just this last week, is if the private sector hit that we've seen gets followed by a bunch of public sector layoffs, this recession could get extended into a long-term recession or even a depression. So the HEROES Act that I mentioned, which has passed the House, provides some substantial support to help states avert those significant cuts, targeting specific funding for both K-12 and higher education. I think that's really important because we don't want to see this recession extended. And frankly, I think that's one of the takeaways from the 2008 crisis, when you didn't see the federal government step up adequately to prevent those job losses. Finally, let me just add, I've kind of bristled every time I've heard the press refer to what Congress has done so far as stimulus. I actually don't think that's true. I think what the federal government has done so far is focused on stopping the bleeding. At some point, we need to talk about what economic stimulus looks like. Next week, the House will be voting on a bill called the Invest in America Act, which is a roughly $1.5 trillion infrastructure plan that focuses on investments in roads and bridges, in transit, in school construction, and trying to kickstart housing construction, including development of affordable housing. A lot of these ideas and many of the components of this bill are bipartisan. I've never seen a Democratic road or a Republican bridge. We know we have transit systems in need of repair. We know we have a power grid that's waiting to enter the 21st century. So I think this is a real opportunity. I do want to flag also, because I know the Public Utility District in Kitsap has really leaned in on this, part of the focus is also on broadband. You know, one of the things we've learned from this pandemic is access to the internet is not just about whether you can watch Tiger King on Netflix, which, by the way, was completely bonkers. But it's about whether, if your kid's school got canceled, whether they can keep learning, or if your business storefront got shut down, whether you can keep operating, or if you've been made unemployed, whether you can go online and apply for unemployment. And for far too many Americans, the answer to that is they can't. And so you will see in the bill next week a very significant investment in infrastructure across the board, including trying to bridge the digital divide, which is something I've been working on. I'll also just mention very quickly, part of stimulus or rebuilding our economy also has to focus on worker training. The reality is we have about 40 million Americans who have filed for unemployment. Some of those jobs may come back, but some may not. And one of the concerns that was raised by the chair of the Fed is the erosion of skills. And so I have recently introduced a bipartisan bill called the Skills Renewal Act, which would provide a flexible skills training credit that would be refundable in the amount of $4,000 per person that they could use to pursue apprenticeships, college classes, retraining programs, so folks can learn new skills, land new jobs, and earn a good living. So I know I just threw a lot at you, but hopefully that gives you a sense of some of the things I think will be needed to help us get through this and hopefully rebuild and grow our economy going forward. And again, I just want to thank KEDA and the leadership of the KEDA team in trying to make sure that we're protecting our employers. To every employer who's watching, thank you for doing business in Kitsap County, and please don't hesitate to reach out to me and to my team if we can support you. So thank you.
Thank you, Congressman. Because we know you have to leave shortly, I'm just going to ask if folks have any questions for you. So post them on the chat, raise your hand. I'm not seeing anything. And Derek's team, Katie and Evan, are on the line as well. So if Derek has to step off, we can still get some info.
Uh,
Oh, this is a common question. What about the 501c3 that, are not able to participate in PPP?
So the C3 have been actually eligible. The C5s and C6s have not. The HEROES Act actually proposes to change that
Okay.
and to extend the eligibility to organizations like yours, like the Economic Development Alliance and Chambers of Commerce. In my view, that's really important, in part because our chambers, and I see that the question comes from Rex, our chambers, our economic development organizations are really going the extra mile to try to help our local businesses weather this storm when they themselves are really feeling the pinch as well. So that has indeed been a priority for me. I was thankful to see that included in the HEROES Act. We have to see that passed by the Senate, though.
Okay, thank you. Any other questions?
Kathy, this is Cole. Can I ask a question?
Sure.
I probably shouldn't say this, but Congressman, since you started with talking about testing, are you saying that you disagree with our president's position that we should just slow down testing and then we wouldn't have such a problem?
I'm really concerned about statements in that regard. And I say that not in a partisan way. I say that because what we've heard from public health professionals is testing is key to being able to reopen our economy so that your customers feel comfortable coming into your shops and making purchases and going out. And suggesting that testing is somehow related to increasing cases is almost like saying going to the dentist is responsible for an increase in cavities. It's just not accurate. And we have certainly encouraged folks to get tested. Certainly, if you're symptomatic, you got to get tested so that we don't run the risk of further spread. And I say that with the knowledge that, the poll that Kathy ran at the start said more than 90% are concerned about an increase in cases. As much as the last few months have really stunk, what would really stink is having to repeat this exercise because we have a new wave of cases.
Yeah, and sorry, so that was kind of a rhetorical question, but thank you for responding. But more seriously, though, I did see that the federal administration is going to be shutting down the federal testing sites. Is that big news, or were those not really doing much anyway?
I think the concern is the administration has very significantly deferred to states and localities, both from the standpoint of sourcing materials and sort of setting the rules of the road on testing. Frankly, that is counter to legislation that passed and was signed by the president that had bipartisan support to establish a national testing strategy that would define who should get a test, how many tests, therefore, do we need nationwide, and how do we ensure that every state and locality, no matter where you live, that people can get a test. Unfortunately, and again, I don't say this in a partisan way, I'm just saying this as a statement of fact, what we received back from the administration was basically 50 state testing strategies stapled to each other. And unfortunately, what that creates is, again, this dynamic where states are competing with each other for scarce resources, where you have some states with much more capacity than they need and other states that don't. Right now, the state of Washington is in okay shape. They are projecting that they will have scarcities of swabs again soon. And again, this is where federal coordination would be really helpful. That is why Congress, in a bipartisan way, passed a requirement for that. And so far, unfortunately, we just haven't seen the administration be willing to do that.
I have a question, Congressman, if I could. I was hearing that the Consumer Banking Association is asking for all PPP loans below $150,000 to be automatically forgiven because it would save like 70 million hours and bankers' time and $7 billion, they're saying. Is there any traction to that?
There has been discussion of that, and it's been bipartisan. I think, and there's debate about kind of where to set the line, but obviously the rationale behind the Paycheck Protection Program was to try to throw a lifeline to employers that, this is not their fault, right? The medically induced coma that our economy was put into, that's not the fault of employers who are part of our local chambers or part of the Economic Development Alliance. And so providing some grace to employers and providing some flexibility to employers rather than to have any sort of system that's kind of a gotcha doesn't seem fair. I think it's reasonable, they're on the flip side of that, you've seen large publicly financed companies try to take advantage of the Paycheck Protection Program, including some professional sports teams. I've always hated the Los Angeles Lakers as someone who grew up in the state of Washington. Now I really hate them when I hear that they tried to take funding that was intended for small businesses in Kitsap County, not to pay NBA player salaries. And so, in those instances, I think there's value in having very active oversight and even clawbacks. I don't think that makes sense for your mom and pop shops and Main Street employers in Kitsap County and beyond. So yes, there's discussion of that. And I think if there were a proposal to do it in the House, I think it would pass. It's very hard to predict what the Senate will do and if and when it will do it.
Okay, thank you.
Yeah, you bet.
Thank you. Any other questions? And if you do happen to have one, just post it. And if Derek has to step off, Evan and Katie are on the line, and perhaps Evan and Katie could also put their contact information in chat so that folks know how to reach out to Derek. With that, we're going to ask John Kiess to talk. He's going to give us the perspective from Kitsap Public Health. So thank you, John.
And thank you, Kathy. Appreciate the opportunity to be here today to share a little bit with our community partners. So often these forums are essential for us as public health in this time. We do our best to get information out, but it's so important that then our partners that we have in the community can then share that information. So being able to be here today to talk with you is really appreciated, and I'm thankful for it. I'm going to go ahead and move us to a screen sharing mode real quick. I have a very brief slideshow just to give you some information. And hopefully you can see that screen here now.
You're good.
Okay, excellent. I want to make sure someone get affirmative to that. So this is, again, very brief. Again, my name is John Kiess. I'm actually the director of the Environmental Health Division here at the Health District, but I've had the privilege of working as the Health District's incident commander in our coronavirus response for the last several months. So my day job is quite different than my job a couple months ago, but I'm just going to walk you through this and hopefully be helpful for you. So the question about, and I believe it was framed for this presentation today, is 3 months in, where are we? Well, here's how you can kind of see where we are when it comes to positive cases in Kitsap County. And here you've got a graph of cases as they're reported each day in these months along the top here. And then, of course, a cumulative case count in this secondary graph. As many have noted, we saw that big increase, the first wave, so to speak, here in late March and early April. And then about the time that the governor's proclamations and other what we call non-pharmaceutical interventions kicked in, we saw a significant decrease in cases as we moved into early to mid-April. We then sort of flatlined for a period of time, and things were going pretty good, I'll say, where we were still dealing with cases as they arrived. And then of late, this is a concern, and many of you voiced this concern in the poll at the beginning that, we're worried about a second wave. And as you see here in June, we are seeing an uptick in cases, and that is of concern because that could, and I do say could, match the start of a wave sort of curve like we saw back in early and mid-March. So we're keeping a close eye on that. The fact is, in our communities, we can all readily see that people are out and about more. Kitsap County entered phase 2 some weeks ago. More businesses opened up, that sort of thing. So there is concern that because of that, there might be more social interaction, which may increase cases. We are seeing more testing in the county. More testing is available, so that's good news. Some of our cases were from asymptomatic people who were tested because of other reasons, for instance, an elective surgery or something like that. Of course, we didn't see those kind of cases previously. We see them now. So that is adding to some of these numbers you see here. Where are we in the phases? Well, I was hoping to report today that we'd be in phase 3. We're still in a little bit of a holding pattern. Councilman Medina is well aware that as a member of our Board of Health, that we applied for phase 3 on June 19th. The county then submitted that to the Washington State Department of Health, and the Secretary of Health reviews those applications. That's good for us. We had a good data package to submit. I think the downside for us was several other counties were submitting at the same time. So we were in a bit of a queue there, and we're expecting our approval of our application soon. And the reason I say we're expecting approval is because the data that we presented essentially meets the state's metrics for authorizing approval to another phase. So we'll see what we hear from the Washington State Department of Health. Could be any day. In the meantime, we've been working closely with our community to give them more information about how to get ready for phase 3. In particular, the guidance documents that are out from the governor's office, as well as the safety plan template for businesses to help them prepare as they hopefully have somewhat different operating expectations moving forward. The number one thing that we want to continue to press to our community is that we all still need to do things that make sense. Just because we've moved into phase 3 doesn't mean, you know, everything's back to normal. We can stop doing what we've been doing. The things that we've been doing, physical distancing, hand washing, face coverings, etc., are very important. We know they worked because we saw the case data support that locally. So we want to continue to push in our community to individuals as well as organizations that sort of behavior. It's essential if we're going to keep from hitting this second wave or the bounce or whatever you want to term it, in order that we can stay ahead of this and have a manageable caseload in our community. Obviously, for businesses and organizations that are required to, we will work and help guide them through the guidance that's out there. Obviously, this is not our guidance, but we do what we can to provide as much technical assistance as possible to our partners so that they can do the right things for their employees, for their patrons, etc., and be part of this sort of protective net that we've built within our community. And of course, you know, the underlying message, we all need to work together in this. This is not just an individual choice. This is a public choice, and we all have to play our part in that. Go ahead and stop sharing now. Hopefully I'm back on the screen. You know, the thing that people ask a lot is, well, what is the health district doing on a day-to-day basis? One of the most important things you saw was that data, that information that's there. It's so important to us to be able to collect that data because it gives us a picture of what's going on in our community. The other thing that is essential, the number one tool we have to combat this pandemic is contact investigation and work to do case investigation and contact tracing. When someone is reported positive through the state's lab reporting system, we contact that individual, we talk with them about where they've been, who they've spent time with, and then reach out and contact them so that they do not play a role in spreading the disease within our community. And we really, that is our number one job that we have. And we have a team that we've built to do that. We're very proud of our efforts there. It's something that it takes a lot of work. We have to work every day, and we have for months, because we are required to contact people on every day, and we find out about these cases. Under the state's guidance now, we contact the contacts for that 14-day period to check and make sure they haven't developed symptoms, to guide them through testing if they need to get it, all these sorts of things. So we're working really hard on that contact and case investigation. Again, it's our number one tool. And then, of course, a secondary tool, but very important as well, is getting the right information out there. Unfortunately, we're swallowed up by misinformation so often, and I think there's a lot of misperceptions or imperceptions out there about what's really going on, and we try and push out as much information as we can to let people know what's happening in our community. And I could go on, but I won't do that today. We'll give an opportunity for questions. And, I think one thing I want to dovetail on to Congressman Kilmer's statements is testing is important. And we're continuing to try and make sure that the people who need to get testing are getting tested. I think we can say at a local level that has been somewhat successful. That we don't hear situations where people are telling us they can't get tested like we were previously in this pandemic. So we're thankful for that at a local level. However, we are concerned that if we did see that big second wave, then testing supplies, equipment, opportunity, perhaps that capacity would be eaten up quickly. And so we want to try and keep things at a manageable level, and we're going to work very hard to do that. I think with that, I'll pause and give an opportunity for the participants to weigh in or see how you want to go next.
Okay, do we have any specific questions for John at this time? And we will have Q&A at the end as well. Here's one. Are you concerned about moving to phase 3 given the recent rise in cases?
The answer is yes. The concern is there. That's why we keep such a close eye on it. But at this point, we have applied for phase 3. Whether the state approves that or not, that's ultimately their decision. But yes, that is one concern. As restrictions ease, as people interact more socially again, that is a great concern. And that's why that important messaging of we need to keep doing the things that we know work. Physical distancing, hand washing, face coverings. We know those are effective strategies, and we need to be diligent in promoting that within our community.
And tomorrow is the start date for the mandatory face coverings, correct?
That is correct. The Washington State Secretary of Health, John Weisman, has issued an order that says all people will wear face coverings in public places when they can't maintain 6 feet of distance from others. That order goes into effect tomorrow. That is correct. Okay.
I anticipate there will be some pushback, but hopefully most people will be compliant. Any other questions for John? Not seeing any. So Cole, we do have one. What will your message be once we start gathering in real life?
The message is absolutely the same. That idea of we need to continue our good, safe practices, the things that we know prevent the spread of the disease, and be diligent. This virus is going to be with us for a long time. Just because we move into phase 3 doesn't mean it's gone. As the graph showed with our cases, it's still present in our community, and it doesn't take much to spread this around. Hopefully we can stay on top of that, but we need to be very diligent.
Right, because there's still no timeline for the vaccine.
That is correct.
Okay, thank you. Cole, it's now your turn, and thank you for joining us again. We appreciate your willingness to always be there for us.
Kathy, sure. You're welcome. I'm really happy to be here. Thanks for giving me an opportunity to share some of my thoughts on this. I'm going to go ahead and try my screen as well. So hopefully you all are seeing that now. I'm going to, one of the downsides of being the third person is some of what I'm going to say will echo some of what has already been said. But in this case, I think that's okay. I think some of it needs echoing. But I will try to go through this pretty quickly and not spend too much time belaboring some of the points that have already been made. I'm Cole Medina. I'm the president and CEO of the Kitsap Community Foundation. I'm also a Bainbridge Island City Council member, and I am on the Kitsap Board of Health as the Bainbridge Island representative. KEDA asked me to be here with my community foundation hat on, but when I talk about this topic, really, I can't separate out the information I get from all these different roles I play. So I've just gone ahead and listed all three of those roles here. I'm also on the KEDA Board of Directors, I'll add. What I'm going to present is some information, some actual factual information, and also just some of my own opinions and thoughts about this. So let's get into it. Cover three topics. Touch on the pandemic's impact on the nonprofit sector, past and future. Talk about non-pharmaceutical interventions, NPIs, which will retread a bit of the ground that John just talked about. And then I want to touch on systemic inequities as my third topic. So the best way I think to talk about the way that this pandemic has impacted nonprofits over the past 3 months and how it might impact nonprofits into the future is to share with you the results of a survey that Kitsap Community Foundation and Bainbridge Community Foundation administered about getting close to 2 months ago now. So the data is getting a little old, but I think it's still useful. So you can see here that we distributed at the end of April, closed May 6th, 112 different nonprofits took the survey. You can see the breakdown there. Yellow, the largest grouping was health, housing, and human service nonprofits. And I'm sorry if you hear strange noises. My son is here with me. You guys can see the donut there. I'll move on. So areas of greatest need. The question was, well, what do you most need right now to help you get through this crisis? And as you might expect, funding for programs is the largest need. So green is, we don't really have any increased need for that. The light yellow is a low moderate need. The darker yellow is a high need, and red is extremely urgent. So funding down at the bottom is, of course, what nonprofits 2 months ago were most in need of to help get through this crisis, which of course is not surprising. PPE was kind of in second place after funding. We asked them how many took part in the Payroll Protection program. I was surprised to see that it was 50, I think it's 53%, maybe it's 52% said yes. I thought that number would be higher. Hold on a second. Hey, Kai, could you please not talk? Okay. Sorry about that. So this is, hey, those of you who have, if you've submitted a PPP application, what's the status of that? So the gray and the yellow is organizations that had not submitted a PPP application. So it's the green, darker green, kind of light green and orange that matters here. So most of them had been approved or were pending approval, and a small number were in the queue. And by this point, I assume most of those have been approved. So again, I'm surprised only 53% of the nonprofits applied for PPP funding, but it looks like most of them that applied received it or should have by now. This just shows some other stimulus programs that local nonprofits applied for, the largest one being the Economic Stabilization Fund, and the second one being the EIDL loans, Economic Injury Disaster Loans. And we asked, how many of you have laid off employees. And this was as of May 6th. 30% reported they'd laid off or furloughed at least one employee. I was surprised that number wasn't higher, frankly. Of those 30%, you can see that 16% reported they laid off 100% of their staff, and 32% reported they laid off 50 to 99% of their staff. So basically, half of the nonprofits who had laid off staff had laid off 50% or more of their staff as of May 6th. I guess as of May 1st. You can see the other numbers about if they think they'll be able to bring the staff back or not. Of course, the biggest number is they don't really know, as many of us don't know how things will proceed here. This is, how much funding do you think your organization, how much of a decline do you think you'll see in your revenue this year as compared to a prior year? And what this is showing you is the number that said, for instance, the number of respondents who said, we anticipate a 91 to 100% revenue decline is 3. So 3 of the respondents said, we anticipate 91 to 100% revenue decline. You can see that about 27, which is about a quarter of all the survey respondents, so about 25% of local nonprofits said they were expecting a 41 to 50% revenue decline this year. And if you add on the ones that are higher than that, you're getting close to 40% of local nonprofits who anticipate revenue decline of 40% to 100% this year. Those are pretty big numbers. And then we asked about survival window. So this is referring to social distancing. So it's not referring to just a stay-at-home order. This is referring to social distancing, the NPIs. So some of this is already old since we're now at the end of June. But hey, if we have to continue social distancing through July 2020, what do you think that will do to your organization? Green is, we'll survive, not really a big deal. Yellow is, we'll likely survive, but we'll have some challenges. Orange is, we'll survive, but we will have significant challenges. And to me, that means we will be different when this is over, if we are having survived. And red is like, we will probably fail. So if you go out in time, you can see if we go social distancing through March, you're getting to the point where 25% of local nonprofits say that they will fail if we have social distancing through March 2021 and go out through June, you see the number gets even bigger. So if you go through June and you add up the we will fail and the we'll likely survive, but we'll have significant challenges, that's 85% of nonprofits if we're social distancing through June 2021. So what does the future hold for nonprofits in this crisis? Of course, no one really knows. We have to see how this all plays out over the rest of the year, but it could be very dramatically bad. And in part, it'll be bad because I don't think, personally, economic recovery is not going to be quick, and that will impact donations, not just now, but into next year. I think for the first 3 months of this crisis, our public has really responded. The government has responded with PPP loans, but the public has also responded and been very generous with a lot of nonprofits. And that's going to tail off over time as individuals continue to suffer and they're not able to be as generous. And of course, government revenue is declining. The county, last I heard last week, when they're planning for next year's budget, are looking at 5% reductions in all their departments across the board because they know that they're going to have reduced funding next year. That's true with all of our cities. I think it'll be true at all the government levels. We've probably all heard that at the state level, the prediction is a $9 billion shortfall over the next 3 years. That will impact nonprofits. And a lot of the other sources of revenue for nonprofits are going to be decreased this year as well. If you can't have fundraising events, you can't raise money at fundraising events. So I'll move on to non-pharmaceutical interventions, past and future. And the summary point for me here is broad use of NPIs will determine our future. How well our community actually uses NPIs will determine how long this recession lasts and for how long this virus continues ravaging our community. So as John talked about, we apply to move forward to phase 3. I just want to read to everyone some quotes from that application. The application includes a memo from our health officer, Dr. Turner, and from our health district administrator, Keith Grellner. And that, it's kind of a cover memo. And I want to read some of what that cover memo says. Movement to phase 3 of the governor's Safe Start plan will increase, underlined, will increase the necessity of personal responsibility of all residents to comply with public health guidelines and recommendations, and will require the careful planning and implementation of public protections by Kitsap businesses that are allowed to open with limitations. The move to phase 3 will place additional Kitsap County residents at risk of exposure to COVID-19, including the risk of severe illness and even death. Outbreaks at businesses and in healthcare settings will be much more likely, resulting in additional business hardships, stress on public health, and healthcare and individual stress. Along with the revived spread of COVID, infrastructure and essential workers are at elevated risk of COVID infection, which may interfere with the operation of healthcare, government, law enforcement, and community services. Under phase 3 of the Safe Start plan, significant non-pharmaceutical interventions for disease control remain in place and underlined and are essential to prevent spread of COVID-19. Kitsap residents and businesses will not be simply returning to the old ways of doing business. Significant behavior changes required to the public and of businesses, required of the public and of businesses, as well as significant physical changes at businesses. So while the health district and the county have applied for phase 3, they recognize in the application that moving to phase 3 will cause more infections and could cause this to get out of control again if we don't, as a community, come together and follow all of the NPI guidance about masks and social distancing and sanitizer and all the protections in businesses. So that is critical. It's really my most important point here. Over the next 3 months, we must, or the next rest of the year, we must all come together and follow these NPIs, or we very well could be facing the long recession or a depression. So I want to talk about a few details of that. Bainbridge Island City Council a few weeks ago started the process of promulgating and then approving a ordinance that would require face coverings in retail businesses on the island. We were, I think, going to approve that on Tuesday, this last Tuesday, but then we didn't need to because the governor issued his own face covering order on Tuesday, as I think you all know, and that order is effective tomorrow. It does require face coverings in all indoor public spaces. So it requires face coverings in all businesses where you are indoors, it's public, you must wear a mask starting tomorrow. And it requires face coverings outdoors if you can't maintain a 6-foot distance. So if you're in downtown Winslow and you're walking down the street on a Saturday with a whole bunch of people out, you're really supposed to be wearing a mask or some sort of face covering because it's kind of impossible to stay 6 feet away from people as you're walking down the sidewalk. Now, is that enforceable? I don't know, but a lot of the point of this is to just try to get people to do the right thing as much as they can. And of course, there are exceptions for medical conditions or if you're deaf or for children under 5, they do not have to wear masks. And it's a misdemeanor to violate this. But again, how will enforcement work? No one really knows that yet. To help with PPE, personal protective equipment, we set up a Kitsap Small Business Response Fund here at the Community Foundation in partnership with all the local chambers. They're trying to raise money for that to support their efforts to educate all the local businesses and help local businesses with reopening and obtaining PPE. And we're working with the County Emergency Operations Center. We have hired here a employee whose job will be to work at the EOC and help the EOC vet suppliers of PPE and make that vetted information available to all of the organizations, nonprofits, businesses, and government entities here in the community so that everyone can start to have secure sources for PPE. And then finally, systemic inequities, past and future. As I say here, it's really inexorably intertwined with the COVID-19 pandemic. They're just so intertwined. One impacts the other in so many ways. I feel like we have to talk about this as part of the crisis. So I wanted to share this quote. I'm just going to read this to you. You'll probably read it before I read it to you, but in her essay, The Pandemic, hold on please, Kai. In her essay, The Pandemic is a Portal, the Indian novelist, I just can't say her name, so I won't try, captures this wisdom. Historically, pandemics have forced humans to break with the past and imagine their world anew. This one is no different. It is a portal, a gateway between one world and the next. We can choose to walk through it, dragging the carcasses of our prejudice and hatred, our avarice, our data banks and dead ideas, leaving our dead rivers and smoky skies behind us. Or we can walk through lightly, with little luggage, ready to imagine another world, and ready to fight for it. Acknowledging the presence and effects of racism by appealing to shared values, explaining its roots and offering solutions, and advancing an affirmative vision of a collective future can help create the systemic and cultural change we need to move into a safer, healthier, more equitable new world. Now, you might care about this issue because you just care about this on a human level. If that's not why this speaks to you, you might care about this issue just because of the economics of it. Roughly 20% of our population here is population of color, communities of color, non-white. If 20% of our population here is suffering economically and suffering even more now because of this crisis, that is bad for our economy. So you can look at this as just a human issue and care about people, or you can also just look at it as an economic issue. We must help everyone in our community do better, for all of us to do better. And you can see how the crisis has impacted just the pandemic itself. Roughly 20% of our population, as I've said, is non-white, but 53% of our positive cases here in our county have been with non-white people. KEDA's stepped up to the plate here, and KEDA is going to be forming a committee made up of members of these communities of color to advise KEDA on how to change its own operations to try to help those communities do better economically. And here at the Community Foundation, we have started a Kitsap Equitable Communities Fund that is raising money specifically to be used to try to lessen the inequities that have been caused or exacerbated by COVID-19, especially those inequities in communities of color. And all the money being donated to that is being matched right now, actually, through All in Washington from a grant from Jeff Bezos. We're gonna take all that money and make it available for organizations that are run by members of the community of color to actually make the decisions on where those grants go and where they're used, because we trust they know best how to use that money. So that's everything I want to say. Thank you very much for having me today.
Thank you, Cole. And for those who want more details on KEDA's response, it is posted on our website, and we are asking for help from those communities, your input and insights. So thank you for just reminding all of that. We do have a few minutes for questions, so please post them. And again, if you don't have questions, we will just close early. I will remind you again, our next webinar is not until July 16th. We do continue to post daily on our website, all things COVID related or small business related. So just because we don't have a weekly webinar doesn't mean that we don't have current information for you. Katie did post the contact information for herself and Evan Smith from Congressman Kilmer's office, if you want to get in touch with them. If you don't find it, or didn't catch it, you can always contact us at KEDA, and we're happy to share that with you. Any final comments from anyone in the panel? Monica and Jamie are here as always. So let's start with John, if you had any final comments.
No, I just want to thank you again for the opportunity to share and get information out there. I know one of the participants asked about our slides and the slideshow being available. Certainly that's there, and I believe you mentioned that you'd have this recorded. Additionally, I would strongly recommend visiting our website, which links through to the state's website, the governor's website, etc., where you can find a wealth of information. The data I just showed you is straight off our website, and that graph, those case counts, they're all updated daily. Lots of links to other information that people may find useful. And please share that out through your networks, through your organizations, to get the right information in people's hands. There's so much bad information out there that we just really want to try and make sure people are hearing the right things. And thank you again.
Thank you, John. We appreciate you sharing with us. Monica?
Hi. I think really the one thing that is timely, because I see it all over social media right now, is there's a post going around about the ADA, the American with Disabilities Act, and HIPAA, and that the mask ordinance is goes against those, and therefore everybody is eligible to not wear masks based on those two laws and regulations. And I just want to put it out there that that is a false statement. There are so many aspects to ADA and HIPAA, and so employers and business people and the general public really needs to know that that little Facebook post that's going around rampant right now, don't rely on that. There are so many other aspects to ADA and HIPAA, so make sure that, you know, like Cole mentioned, we're all doing our part for the greater good. Thanks.
Thank you. Thank you, Monica. I hadn't seen that yet, so goodness gracious. Jamie?
Yeah, I just wanted to say that I'm still continually surprised at how many people didn't know that they could get the PPP, and this week might be the last moment to apply because banks are shutting down applications. I know I put that in the chat box. And then EIDL, the Economic Impact Disaster Loan, EIDL, that's been opened up again to sole proprietors and some of those folks. So if you didn't get a chance before it shut down the first time, you might want to take a look at it again to see if you qualify at this point. And it was interesting too, and Cole, the Bainbridge Chamber apparently promoted the Small Business Development Center, and I've been getting this steady stream of people saying, I saw the Small Business Development Center on the Bainbridge Chamber notice, and so can I ask you a question? And if you have just short questions, I'll answer them just as fast as I can, and you don't have to necessarily wait for a counseling session if you don't have anything more than a quick session. So, happy to answer questions with facts. We've been really staying up on PPP and EIDL throughout the state network of small business development centers. Thanks.
Okay. Cole?
Yeah, I just wanted to say one thing. I wanted to thank John and thank our health district and let everyone know, if they don't know, that one reason why our case counts have been so low in our county is because from the very beginning, our health district started a really robust contact tracing program and diverted more than half of the staff within the health district to work on contact tracing. And they have been doing that diligently. And that didn't happen in King County and many other places. So I just want folks to know we have a great health district. John, you and everyone there have been doing a great job, and I'm thankful.
Well, that's really impressive. And when he was describing the daily work that they're doing just for contact tracing, I was impressed. So yes, our congratulations and thanks, John. Evan or Katie, do you have anything to add?
Hey, this is Evan Smith from Congressman Kilmer's office working on economic development. Just wanted to thank all of the panelists, and thank you to KEDA for giving us the time. And as Kathy said, as Congressman Kilmer said, our office stands available if you need any assistance, whether it's navigating these small business loan programs or any potential advocacy on policies that we're looking at in DC. Our office is available to you, and please don't hesitate to reach out.
Thank you, Evan. I just want to say again, KEDA is thankful for all of the partnerships that we have. And these weekly webinars are, just showing you examples of those partnerships and how together we will continue to help small business, recover and grow in Kitsap County. And with that, we will see you on the 16th. Thank you for joining us.